Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, April 8th, 2020, my COVID-19 update. A couple of things today that I'll go over, and then my wife Kim's going to ask me some questions that people are posting somewhat repetitively. So that way we can answer them and get them taken care of and get the information out. So statistically today, pretty steady state. There's about not quite 1.5 million people infected. I think we're about 80,000 deaths worldwide. New York's still having tremendous problems. Obviously, we had over 2,000 deaths today in the United States, which I think is referencing what the Surgeon General said, that it was going to be a hard week, clearly. So we're at about 425,000 to 440,000 in the United States, total cases. We have about 14,000 deaths. Oklahoma, about 1,600 cases and about 80 deaths. So our numbers haven't changed that much from yesterday. I think the big news today, I listened to most of the news conference after Trump. I did not get there in time to listen to Trump. And there wasn't a lot of significant news except for this change in the drumbeat or the messaging, which I think is a positive but a negative. And the positive is it looks like some of the things that have been done are working, notably on the West Coast with sheltering in place. Sheltering in place clearly works. Social distancing clearly works. Washing our hands clearly works. And adding masks is clearly going to work. So that's why we have these models now on the West Coast showing remarkable effects. We've been a little bit better on the East Coast, and we've done better in the Midwest. And it actually looks like it has some high potential to flatten the curve. And that's great news, and that's wonderful, and I think we all need to be really excited about it. But the mistake is maybe overemphasizing that a little bit in the news conference. Now, they tried to back off a little bit and say, well, we still want you to stay at home. This is the whole point. You really need to stay at home. You need to stay at home for at least 3 more weeks. You need to socially distance for at least 3 more weeks and follow the CDC guidelines. I mean, the only thing that's happening, which I mentioned last night, is the curve, instead of going like this, up, we're just turning it this way. So we're going to have to deal with the longer term, but we're blunting the shorter term. But it's really easy to unblunt the short term if we don't continue to follow the plan. And I think that's really what Pence was talking about. First, he talked a little bit about, mentioned there are several trials now for hydroxychloroquine ongoing. They're getting started. There's been already some ongoing. So that's great news. They're looking at a variety of different avenues for treatment. Trump did mention zinc, and there may be some synergy between zinc and hydroxychloroquine. If you've been watching these posts, I mean, I've been talking about zinc for 2 solid months and how important it is. And I may have mentioned in passing a few times that the zinc and the hydroxychloroquine clearly interact together. And the hydroxychloroquine makes the zinc work. But zinc is a key concept, which is something we've talked about. And just to highlight it again, you want to be on 50 milligrams every day and then pulse it to 50 milligrams an hour for 4 hours at the first sign of any flu or illness. And you want to do that in the first 8 to 12 hours. And you always take zinc with food because it can upset your stomach. There's different doses for children. I have a whole video on this if people have questions, so please watch it. I don't want to repeat all of it again. And the other thing is melatonin really helps, and I think melatonin is a key additional supplement to take along with a multivitamin and vitamin D. And I think those are your core scientifically based or evidence-based recommendations for immune support. Iodine also plays a role in this too, and a lot of vitamins will have a little iodine in them. So that's the main thrust of the conference today. Dr. Fauci and Dr. Birx basically said the same thing. And then Dr. Redfield, the CDC director, brought up that they're going to relax some restrictions on essential workers if they get exposed and are asymptomatic. And that's probably a good idea, because if lots and lots of health workers are getting exposed and then none of them work when they feel fine, that's a problem. Now, there's going to be restrictions. They're going to have to wear masks. They're going to have to take their temperatures multiple times a day. They're going to have to be honest if they're getting any symptoms. But if they're wearing a mask and they're afebrile, and that's pretty reassuring. But we have to have enough healthcare workers and people distributing food so the whole country stays sane, and that was what that was about. So I think that's a reasonable plan. Besides that, there wasn't much new news. We just basically have to wait for the next 3 weeks and see how it goes, and hopefully it will go as well as we're expecting, as long as everyone follows the plan, which is to still shelter in place and socially distance. Now, Kim has a bunch of questions for me. She's going to start reading them to me, and then I'll answer them. So go ahead, please.
Okay, so you were talking about zinc. So more about zinc. People are wondering the different kinds between the gluconate, the sulfate, the picolinate.
Picolinate.
Yeah.
So
Does it make a difference? Does it make a difference with the dosing? And are all of them just as effective as the others?
Well, that's a great question. Does the type of zinc matter? Well, I think classically zinc gluconate is the most studied and most understood. So that's usually what we recommend first. Zinc piconolate is also studied very, very much and understood, and the absorptive characteristics of both those are understood. So those are usually our first lines. And the zinc sulfate is something you can use. It's a little harder for me to determine dosage on that one because it's different than what's been used in studies. Not that there's a ton of studies that have actually been done on cold and flu. What we have studies showing how it works and how it interacts with viruses in tissue culture. And so we have an idea on how it works and why we know definitely why we want you to use it. But some of the absorptive characteristics of the other types of zinc aren't as well established. So 50 milligrams of either zinc gluconate or zinc picolinate would be my first choices, and then the other one secondary.
Okay, what are your thoughts on antibody testing?
Oh, antibody testing. Great question. I was in my text group today, and one of the doctors, Bill Bondurant, had texted a question about that, and because a patient was thinking about getting it and spending $100 on it or something like that. And David Chansome, the head of infectious disease at Integris, who was one of the members of the news conference with Governor Stitt yesterday, answered very quickly that we don't even know what the antibodies mean yet. I mean, yes, antibodies can show immunity, but we don't know which antibodies are going to be important. Is IgM meaning you're immunocompetent against it, or is it IgG? It should be IgG. And two, what are the cutoffs for positive and negative? And what's the sensitivity and specificity of the test? So all that's unknown. So getting antibody tests at this point isn't that helpful. I mean, eventually I think it'll be very helpful, but we have to get it defined in terms of what it means before I'd run out and spend money on it.
What are your thoughts on curbside and takeout food? I know you've been asked this before, but...
Well, I think the answer to that is nothing can be perfect, and so getting curbside or takeout food is always going to have some risk adversity. But by the same token, when you get the food, if you have a mask on, you sanitize your hands, and you needed to get the food, I mean, sometimes you need to get food and you need to get takeout because you don't have anything else to eat. And I think it's definitely something that you can do. I mean, we want everyone to stay at home and eat food from home as much as possible, but we have to be realistic. So doing takeout food and making sure you have hand sanitizer in your car to clean your hands as you get the package, and then when you get home, making sure you open things carefully and get the food out is about as much as you can do for that. And then just remember to wear a mask when you're picking up the food.
Okay, should we be wearing masks on walks and bike rides?
Yes.
Even if we're social distancing?
Yes, I think it's just a smart decision now to wear a mask, whether you're walking outside or on a bike ride, or at least a facial covering like a buff. I think we should all still be very, very zealous about that. I think that the next 6 to 12 months is going to take at least that long, because remember, the virus is going to be there. There's going to be a baseline infectious event pretty continuously for probably 12 months. Now, it may wax and wane through some of the seasons, but there's going to be people getting this virus and getting sick and then getting critically ill. So, You want to do things you can to avoid it until we either have an injection size, so you just get antibodies that will go in your system and protect you from a viral exposure, until we get a vaccine where that then stimulates you to make your own antibodies. So until one of those two things is up and rolling, I think we really want to keep our faces covered in public.
So this one's probably more just opinion, but with dentists being closed for general care, and then general care like you doing annuals, things like that, do you foresee that causing more problems than if everything was going about like normal?
Well, I think the answer to that is it was the right choice. And in particular with dentists, one of the things to understand is the oral and nasal pathways or openings are where most of the virus is. So if you are doing a procedure in the nose or by the nose or in the mouth, that's how you get the virus to go whoosh when you're rinsing or spraying or doing stuff. And so that fills the entire room with viral particles and puts the healthcare providers at high risk, which is why dentists and ENTs need to really be very, very careful with any procedures they're doing right now. So I think that won't cause more problems. I think dentistry in general is doing emergencies. I have a son who's a dentist. He's doing not very much, but he's working about a half a day a week on emergencies right now, which is painful for him, but it's how it is for all of us. In terms of our office, we're still doing care. We're doing a lot more telemedicine care. Probably 3/4 of our visits are via telemedicine. But what we're not doing is annual exams, because anything that's preventive isn't needed right now. So we don't want people coming to a doctor's office for preventive maintenance, and that applies to dentistry too. If you're having a problem, yes, you want to go and see your doctor or your PA or your nurse practitioner or your dentist or your chiropractor, but I think you want to avoid going in for just a maintenance thing or a check when you feel completely fine. That's not the purpose that's not our purpose right now.
Okay, and you talked about hydroxychloroquine. There were several questions. One, is there a shortage? Two, how do people get it? And three, is there no proof that it actually is working?
No, well, I think first, the shortage of hydroxychloroquine is abating. People can get it for if you have lupus or rheumatoid arthritis pretty routinely now. I think there was a brief time a few weeks ago. If you get sick, I believe in a lot of the hospitals across the United States, if you get sick with COVID and you're going down the wrong direction, you're going to probably get hydroxychloroquine. A lot of the facilities in Oklahoma City have already used it, not in a study, but as an option. Remember, the thing about hydroxychloroquine is it's an FDA-approved drug. It's an FDA-approved drug. And we as physicians, as a licensed physician, if there's a scientific basis for writing a prescription of it, that's not the FDA indication. That is fully allowed by FDA guidelines. It's called an investigational new drug exemption. That came around in the late 60s as the FDA really was getting going with some of this pharmaceutical regulation. So all providers who are licensed can write a prescription for a medicine that's not an FDA indication if there's scientific proof. And I would always use just a simple antibiotic as an example. All providers do this daily with medicines because medicines get approved for generally one thing or two things, but it turns out they'll work for more than one thing. And if you think about, like, everyone's talking about a Z-Pak, potentially as an add-on to the hydroxychloroquine. Well, a Z-Pak was approved originally for upper respiratory tract infections and sinusitis. Do we use it for that in my office? Yes, but I also use it for some skin infections or things, or a vaginal infection. That wasn't its original FDA indication, but the science is there for me to do that, so I do it. And that's how the investigational new drug guidance and regulations from the FDA works. So anyone who's a licensed provider can write hydroxychloroquine for COVID-19 because there's data supporting its use. And that's the key concept. Now, do I think it's going to become much more prevalent? yes, in terms of its use in the United States and across the world for this disease process. There's a study on prevention for healthcare workers. So again, hydroxychloroquine is a reasonable thing to use for COVID-19. I don't think it's that big of a deal to begin with. I've never understood why the FDA took the stance it did, because you use these anti-malarials all the time for people going on trips for 2 weeks, and it's never been a big deal. And so all of a sudden using it for 5 days to save someone's life for COVID-19, they're all freaky about. But hey, I don't understand the government clearly, so it's just one of those things. I think I answered that pretty much.
Yeah.
Okay,
Yeah.
good.
So if there's a second wave, which you talked about before, would the people that have already been infected be immune?
Yes, we think they should be immune. I mean, we don't have a definitive study on that, but we know that people who've been infected and recovered, when you take their plasma and get their antibodies out and give them to someone who's really sick, those patients get better. So I think we can assume that they wouldn't get better if the antibodies weren't working. So if you have those antibodies as a baseline, you're going to be protected from the virus. And that's the whole concept of giving a shot of antibodies to people who haven't been infected. When you synthesize those same antibodies in a lab and you give them to the person, that person will be protective. And that's the whole concept of vaccines. You're going to make an antibody in response to the vaccine or the protein injection of a part of the virus that's not active, to then, when the virus comes in, you make the antibodies to inactivate it or bind it up.
Okay, and then lastly, somebody was asking, where do you find the daily cases? And then someone else was asking, like, where specifically do you look?
Okay, so in terms of ventilators and things like that in the state of Oklahoma, that's not as easily accessible. There's a dashboard for hospital administrators and chief medical officers and stuff like that. I don't have access to it. I get them. I can ask someone to send it to me in my group, and they will. But that's more background data for the people who are in the decision-making mode. But the thing I can tell you is we are in fabulous shape here. We have lots of ventilators, lots of beds as our case numbers come up, and a very highly motivated group that are using that data to our advantage. And again, my compliments to Casey Schrum. Sorry, Dr. Casey Schrum, who's is the lead physician in the Oklahoma State Task Force managing COVID. She's doing an amazing job with resource management. I was very impressed with her last night. Yesterday, I think we all were on our call. She has a clue, and I mean, they have this down. In terms of other, other sites for, that's allergies. Other sites for information, I'll post the one I use for the world sites for everyone. And then I use the New York Times also they have a great app or site for updates on US cases. They also have one for world cases, but I don't use that one as much. I use this other one. So I'll post the other one. But the New York Times has a good app too. So I think that's about enough time. That's 18 minutes and 25 seconds. So probably everyone's gone by now. So have a wonderful evening and take care. Good night.
Okay, everyone that's been giving feedback on the sound too, we're using a new microphone. Please let me know if that's better.